Palliative care for the COVID-19 patient. This video is aimed at healthcare workers caring for patients dying with suspected or proven COVID-19 infection. Recommended dosages for all drugs are listed on the final slide of this presentation. COVID-19 can cause severe disease. Some people of all ages will become very sick with COVID-19. Patients with chronic conditions such as heart and lung disease and the elderly are most at risk of dying. But it is important to remember that most will still recover. Patients over 70 years have had a fatality rate of 8%, so 92% survive. Deterioration may occur rapidly and is most likely during the second week of the illness. If someone is severely ill, you need to consider whether admission is appropriate. It may not improve outcome for the patient who may be more comfortable in their own home. Admission also increases the risk of infecting others. Who should you consider for palliative care? Palliative care should be considered in patients who are unable to walk, who are semi-comatose, or not taking food or fluids orally. Ask yourself the question, would I be surprised if this patient died in the next day or two? If you would not be surprised, you should consider what management strategies are required and whether a focus on symptom relief should be considered. Some patients, particularly those who were frail before getting sick, may not have distressing symptoms and may not need medications, so treat people based on their symptoms. Common symptoms for the patient dying with COVID-19. Common symptoms in the dying COVID-19 patient include breathlessness, pain, fever, agitation or distress, and inability to manage day-to-day tasks such as washing, dressing, or eating. Patients may be too unwell to take medications orally, so may require subcutaneous or rectal administration. Symptom control. Breathlessness. Oxygen may be considered for breathlessness, but it is only of benefit if oxygen saturations are low and if you have adequate supply for other patient groups. A fan blowing over the face will ease the sense of breathlessness. Opioids including morphine sulfate will relieve breathlessness, pain, or severe cough. Benzodiazepines including diazepam or midazolam can help with agitation and breathlessness. Symptom control. Pain, nausea, and agitation. Opioids as prescribed for breathlessness or rectal NSAIDs may be useful for pain. Antiemetics like prochlorperazine or metoclopramide may be needed for side effects of opioids or for nausea. Haloperidol can help with nausea and agitation. Other symptoms. If marked fever, consider rectal paracetamol or NSAID. Marked respiratory secretions are uncommon with COVID-19. Hyoscine butyrbromide buscopan can help. Antibiotics and intravenous or subcutaneous fluids are not of benefit in improving symptoms. Care for guardians. Remember that guardians of patients with possible or proven COVID-19 are at risk of infection, whether in hospital or at home. If a guardian must remain with a COVID-19 patient, then the patient should remain in one room if at home or in isolation if in hospital. It should be well ventilated with open windows and door. Guardians should be in good health with no underlying chronic or immunocompromising conditions. Household members should maintain a distance of 1 to 2 meters from the ill patient. Non-essential visitors should be discouraged. Encourage hand washing, masks, appropriate disposal of tissues, dedicated plates and cups, and regular cleaning of surfaces. Patients should be encouraged to wear a mask to contain respiratory secretions. If this is not feasible or not tolerated, cover the mouth and nose with disposable paper tissue when coughing or sneezing, and discard immediately after use. If cloth is used, wash after each use with soap and water. Recommended drug dosages.